is the Onkyo processor, for instance, I know will be better than what we've got. Because it's at least got X32, it's got all that sort of stuff. But I'm really keen to hear balanced because on the Leviton, because that's what
you've got the capability now.
Someone just smacked something there.
Burnt?
No.
No, it was glass.
Glass.
What the hell?
Oh, that guy's window. He smacked something. I think he smacked the car, but he just carried on driving.
Yeah.
His whole window is smashed out and the mirror and everything. Yeah.
They made a prank into two cars prank.
Well, the cars were standing on the side, so maybe.
Yeah. It's carrying on. It's not yeah.
Actually, back down that number.
Yeah.
Is palpable. A man in Guinea suspected of having the gruesome disease was left lying in a city street for hours. Passers-by too scared to help, medical resources stretched thin.
Let them come and take him from here, because we are afraid.
More than 930 people have died in the outbreak. The military now helping combat the spread of Ebola in Sierra Leone. Liberian soldiers are clamping down on travelers. No one with a fever allowed in or out of the country. And in Spain, health officials reassuring the public there is little risk of Ebola spreading from an infected priest evacuated from Liberia, now in isolation at a Madrid hospital.
He is stable with fever, and the most important thing is that Father Miguel is not hemorrhaging. This is a sign of a positive prognosis.
The World Health Organization will soon decide if the Ebola outbreak is an international public health emergency, which could initiate a more global response. The CDC is operating on its highest alert level, the first time since the 2009 swine flu pandemic. The agency's director briefed representatives on Capitol Hill.
We, with our partners, have been able to stop every Ebola outbreak to date, and I'm confident that if we do what works, we will stop this one also. But it won't be quick, and it won't be easy.
Dr. Thomas Frieden says tried and true infection control methods, diagnosis, isolation, and tracing patient contacts are the best way to end the outbreak. Cindy Sharp, Associated Press.
As the medical world continues to grapple with Ebola, there are growing calls for experimental medicines to be used more widely. 2 American aid workers infected with the virus appear to be improving after receiving an unapproved medicine, ZMapp, ahead of their evacuation back to the United States.
This is an emergency compassionate use situation. This is not a well-controlled laboratory study. A lot of work remains to be done to see how it worked and why and how quickly. The apparent speed of recovery was faster than I would have expected, so there may be a lot of things that we still don't understand about the virus.
The antibodies were originally harvested from mice that had been injected with parts of the virus. Experiments on monkeys suggest the antibody cocktail may reduce fatalities when given after exposure to the virus. The proteins are then grown in specially modified leaves of tobacco, which act like a photocopier, reproducing larger amounts.
I do agree there's no vaccine. Treatment is experimental. The real way of stopping it is by transmission of the virus, which we know quite well how to do. It's just spreading that message and then providing basic supportive care to people who are being treated at the moment. What we must remember, it's a very isolating and stigmatizing disease, and people deserve to be treated with care and concern, which is what we're all committed to.
The Spanish government is sending a specially equipped plane to Liberia to evacuate a priest who is infected with the virus in the capital city, Monrovia. The World Health Organization will announce on Friday how it plans to slow down or halt the global spread of a virus that has claimed 900 lives in West Africa since February.